name is Yolanda, and as opposed to some of you, I am for the morning after pill. Um, think about some cases where the baby may be fatal to you or fatal at time of birth. Like, would you want to take the pill then if it would help? I know some people are raped and become pregnant. Some people make mistakes and get pregnant. But does that give the person a right to take the pill at pregnancy? A life that's already been formed according to pro-life people. Pro-life describes the moral, political, ethical to abortion, but there's such thing called pro-choice, where they feel like you should have the choice of whatever you want to do with the baby. Reproductive rights test on a recognition of basic right of all couples and individuals to decide freely and responsibly the number, spacing, and timing of their children, and to have information and means to do so. And the right to attain the highest standard of sexual and reproductive health. In addition, the morning after pill is not a type of abortion. Within the first 3 days, life has not been formed. The sperm is getting to the egg, and what the morning after pill does is prevent the egg from being fertilized. So if the egg is not fertilized, then there is no implantation, and technically there is no baby, so it's not an abortion. The life will form within the first week, but the pill is for the first 3 days, in which fertilization of the egg and implantation need not even occur. It should not be banned because even with the emergency contraceptive pill, many teens are getting pregnant. By taking the pill out of the market, the teen pregnancy rate will go up. Teens and females in general use this pill because it's better for or worse compared to abortion. If you read or even watch the ads for the morning after pill or Plan B, they call it, it says that it will not prevent against someone who is already pregnant. So basically it says it will not perform an abortion for you. Having said on both sides, under a normal situation, most wouldn't know that their birth control pill, condoms, most don't check to see if the condom's broke. Most people don't even take the time to see if the condom is expired. Birth control pills almost fail the morning after either, because if you take them in a routine basis, most people would think that it had worked. The morning after pill is an esteem need because accidents does happen, but that doesn't make you a high-profile promiscuous person. I do think in some cases rape, or if you know the fact that your birth control has failed, Plan B is a cool option to have. The morning after pill is effective, safe, and costless in abortion procedures. Emergency contraceptive is also known as morning after pill, emergency pill, backup birth control, and by the brand names Plan B, One Step, Aya, and Next Choice. Plan B, One Step, and Next Choice reduces the risk of pregnancy by 89% when started within 72 hours after unprotected intercourse. They continue to reduce the risk of pregnancy up to 120 hours after unprotected intercourse, but they are less effective as time passes. You need to use the morning after pill to prevent pregnancy after each time you have unprotected sex. The morning after pill will not prevent pregnancy or any unprotected intercourse after you take the pill. Emergency contraceptive is safe. Even though it's made for the same hormone as the birth control pill, the morning after pill does not have the same risk as taking the pill or other hormonal birth control methods continuously. That's because the hormone in the morning after pill is not in your body as long as it's with ongoing birth control. Many of the women have used the emergency contraceptive. It has been used for more than 30 years. There have been no reports of serious complications. The cost of the emergency contraceptive varies a great deal. It may cost anywhere from $10 to $70 as opposed to abortion, which is like $300 to even $4,000 in some cases. Family planning clinics usually charge less than private health care providers and drugstores. Some health centers are able to charge according to income, or if you qualify for Medicare. In 1999, July, Plan B is approved by the Food and the Drug Administration for prescription use as emergency contraceptive. In April of 2003, the Women's Capital Court filed an application in the FDA to make the claim be available without prescription. College students are in high percentage that have unprotected pregnancy, and for secondary schools, you can speak to young students to hopefully prevent the unintended pregnancies. The cause and effects of using the morning after pill are the same effects as when your menstrual is about to occur or the symptoms of pregnancy. Some of the severe side effects associated with the intake of morning pill may include blurry vision, eye problems, chest pain, shortness of breath, extreme abdominal pain, and pain or numbness in the leg or the arm. Many of these things that happen is probably because you already have some kind of complication with your health, but if you're like healthy, it wouldn't make you unhealthy. The sex education classes often give the impression that the egg waits for the sperm to show up. It's usually the other way around. The egg loses its fertility within 12 to 24 hours. It takes sperm about 10 hours to reach the egg, and the sperm can survive in the female reproductive tract for up to 5 days. If you want to get pregnant, you better send the sperm before the egg shows up. But if you don't want to get pregnant and the sperm are already on their way, you still have time to stop the egg with the plan B. The earlier you get the pill, the lower the odds are. And every successful EC intervention spares the woman the greater danger of ending up with a surgical abortion. Plan B should be available for over-counter, so it can be what advocates hope, not for what enemies fear. Don't ban the pill. It is safe and effective for us. Teenagers who become mothers have grim prospects for the future. They much more likely to leave school, receiving inadequate parental care, rely on public assistance to raise a child, develop health problems, or end up divorced. Like any undergirl fertilization. Other difficult situation, abortion creates stress. Yet the American Psychological Association found that stress was the greatest priority in an abortion, and there is no evidence of post-abortion syndrome. The ability of a woman to have control of her body is critical to civil rights. Take away her reproductive choice, and you step into a slippery slope. If the government can force a woman to continue a pregnancy, then what about forcing a woman to use contraceptive or undergoing sterilization? The morning after pill is safe, effective, and costs less than an abortion. It is taken to prevent pregnancy from occurring in the first place. So therefore,